Hello everyone, my name is Talk Elsayed and I am a second year PhD student at the Joint PhD BME program at Georgia Institute of Technology and Emory University. Today I will be presenting a study aimed to compare TSE to multi-contrast atherosclerosis characterization, STAR-MATCH, for measuring common carotid wall thickness by two different observers. I want to mention that Dr. Husseini and Dr. B are employed by Siemens Medical Solutions. Atherosclerosis is a very challenging problem for millions of people around the world, which causes strokes and heart attack. It is an inflammatory disease that causes focal arterial lesions in the carotid artery walls, and during its early stages, an outward remodeling causes an increase in the carotid wall thickness that precedes the development of luminal narrowing and stenosis, as seen in the figure on the right. Therefore, accurately identifying an increase of wall thickness can be a marker of an early disease and a potential marker for a future stroke risk. Carotid magnetic resonance imaging (MRI) can play an important role in clinical evaluation of carotid disease by quantifying not only the degree of stenosis, but also determining wall thickness and identifying plaque components. In this study, we mainly compared TSE to STAR-MATCH. TSE is the standard technique for imaging wall thickness. It is a 2D magnetization T2 weighted black blood slices. STAR-MATCH, on the other hand, is 3D stack of stars magnetization prepared gradient echo sequence. It is a new promising sequence that offers larger coverage and thinner slices. It also offers multiple contrasts, including gray blood, black blood T2 weighted, and hyper T1. In this study, we only compared the STAR-MATCH black blood T2 weighted to TSE. In this experiment, we aim to compare TSE and STAR-MATCH wall thickness measurements of the common carotid only. The data was analyzed by two different observers, and we calculated the inner observer reproducibility. We also calculated and compared contrast to noise ratio of both techniques. We hypothesized that there will be no significant difference of the wall thickness measurements between TSE and STAR-MATCH. The experiment study population included 9 female patients at high risk for atherosclerosis, and they were scanned using a 3 Tesla MR system. STAR-MATCH images were acquired in the coronal orientation and reformatted to the axial orientation. We only analyzed the black blood contrast image. Even though STAR-MATCH have a bigger field of view, we only analyzed the overlapped slices between STAR-MATCH and TSE. Each image set was analyzed for wall thickness independently by two different observers using VesselMass software. The table on the right shows the dimensions for each scan. Note here that the STAR-MATCH and TSE have similar scan time, but STAR-MATCH has smaller slice thickness and bigger coverage in addition to the multiple contrasts offered. The blue box here shows the coverage of the TSE scan. The orange box shows the extended coverage of TSE of STAR-MATCH. The blue lines shows the thickness of each TSE slice, and the orange line shows the thickness and the numbers of the STAR-MATCH slices. Note TSE slice thickness is around 3 mm, while STAR-MATCH is around 0.8 mm. The segmentation was done for the common carotid only, and the lumen was in red and the vessel wall in green. The way we evaluated the suppression of blood and vessel wall signal is by calculating the contrast to noise ratio, CNR, using the equation shown. By taking the difference of intensity between the vessel wall and the lumen divided over the intensity standard deviation of the background ROI in blue. The figure on the right shows the difference in CNR between TSE and STAR-MATCH. Here, we see a patient example scan of TSE on the top and matching STAR-MATCH slice of the same patient at the bottom. In TSE scan, we see better CNR when comparing to STAR-MATCH at the bottom. The figure on the left shows the inner observer vessel wall thickness by two different observers and the two different techniques. Note here that there is no significant difference was found between TSE and a STAR-MATCH. The figure on the right shows the inner observer reproducibility between TSE and STAR-MATCH. TSE did have better variability correlation than STAR-MATCH. This figure shows another patient example. TSE scan on the top shows a big flow artifact that affected our vessel wall thickness measurement. It does not seem physiological. The corresponding STAR-MATCH scan at the bottom does not show the same artifact, but it does show the lower CNR and when compared to TSE. This slide shows our results when we calculated the contrast to noise ratio in both sequences. The figure on the right shows that TSE has better CNR than STAR-MATCH, and there was significant difference between the CNR of both sequences. However, the lower CNR in STAR-MATCH was expected due to 10 times smaller volumetric voxel size and thinner slices. Also, STAR-MATCH had larger coverage when compared to TSE. TSE had 4 signal averages, which also increased TSE CNR. No significant difference was found whenever we compared wall thickness measurements between STAR-MATCH and TSE between the two different observers. However, lower CNR observed in STAR-MATCH did not affect the wall thickness, but it did affect the inner observer variability, and that's why we see lower inner observer variability compared to TSE. STAR-MATCH may provide better alternative for measuring wall thickness with less flow artifacts and shorter scan time. This study did have few limitations since the study subject had wall thickening but no major luminal narrowing. STAR-MATCH CNR was also sensitive to carotid coil placement and patient anatomy. Thank you all for listening and for all the people who helped in this work. Looking forward to receive your questions.